dealing with oral mucous membrane, which is an important 10 marker, which is asked like 3-4 times they've asked. Okay.
Okay, ma'am.
Okay. So see, this is the whole thing covering the mouth oral cavity is called oral mucous membrane.
Okay,
So
ma'am.
oral mucous membrane is the moist lining of the oral cavity, and it is made up of
Okay,
epithelium and the underlying connective tissue.
okay,
Okay.
ma'am.
So
Okay, ma'am.
the mucosa which lines the gingiva and the hard palate is called masticatory mucosa.
Okay, mucosal lining and the hard palate.
Hard palate and gingiva.
Oh, okay, okay.
Gingiva hard palate is called masticatory mucosa.
Okay, ma'am.
Mucosa lining the tongue is called specialized mucosa because it has taste buds inside. It's called specialized mucosa.
Okay, ma'am.
And the mucosa lining the soft palate and the cheek is called lining mucosa. Like other than these, everything else lining is called lining mucosa. Okay. Gingiva
Okay,
and hard palate is masticatory mucosa. Tongue is specialized mucosa. And the cheek and soft palate and other parts of the oral cavity is called lining mucosa. Clear?
okay. Yes, ma'am.
Okay. So next, what is oral mucosa? The moist lining of the oral cavity. The functions of oral mucosa is protection, sensation, and secretion. Okay. It is continuous with
Okay,
the
ma'am.
skin outside the oral cavity and differs from its appearance and structure. So the oral mucosa which is lining the oral cavity continues outside, but it varies in structure and appearance. Okay, till the vermilion border, what we have is called the oral mucous membrane. Clear?
Okay, okay, yes, ma'am.
So now the oral mucous membrane, it's made up of lamina propria.
Okay, ma'am.
So it is basically epithelium and connective tissue. That's what we saw. So connective tissue has
Epithelium and
fibers.
connected.
It's
Okay,
broadly classified as the above epithelium, below connective tissue. Okay. So now
okay,
coming in depth of what is made up of connective tissue and what is made up of epithelium, we have the
okay,
lamina propria, which
okay,
is
ma'am.
further divided into papillary layer, reticular layer, and submucosa. Papillary layer has blood vessels, reticular layer has fibers and nerve fibers, and submucosa has minor salivary glands. Clear?
Okay, ma'am. Yes, ma'am.
Papillary layer has blood vessels, reticular layer has fibers and nerve fibers,
Okay, ma'am.
submucosa has minor salivary glands.
Okay, ma'am. Yes, ma'am.
So now coming to epithelium is the first lining, below that lamina propria, below that submucosa, below that outer layer of the bone which is the periosteum and the bone.
Okay, ma'am.
Epithelium, lamina propria, submucosa. Submucosa has minor salivary glands. Lamina propria has fibers. Epithelium has the stratified squamous epithelium cells. Then that is lined by that is covering the bone, which is the last layer. Okay.
Okay. Yes, ma'am.
I'll I'll be sharing this PPT. Okay. So in this
Yes, ma'am.
PPT it's very clear. Okay. I've made
Okay,
it
ma'am.
more
Okay,
pictorial for you to understand better. Okay.
okay, ma'am.
This is again oral epithelium. Then the basement membrane, which separates the oral epithelium with lamina propria or the connective tissue. Now
Okay,
the
ma'am.
connective tissue has lamina propria or fibers. Then submucosa, which contains blood vessels and nerves and minor salivary glands and the muscle or bone, whatever.
Okay, ma'am.
Okay.
Okay, ma'am.
Oral epithelium forms the surface of the oral mucus that forms a barrier between the oral environment and the deeper tissues. It is
Okay, ma'am.
derived from the embryonic ectoderm because embryonic it has ectoderm, mesoderm, endoderm. 3, correct?
Yes, ma'am.
So epithelium, oral epithelium is formed from ectoderm. It is
Oral
made up
epithelium
of
is formed from.
ectoderm.
Okay, okay, okay.
See, ectoderm, all the visceral organs are formed from endoderm.
Okay, ma'am.
Muscles are formed from mesoderm. And the outer covering skin and the outer epithelium, all that is formed from ectoderm.
Okay, ma'am.
Okay, go from outside to inside. Endoderm forms the visceral organs, that is the stomach, the heart, the lungs, the kidneys, all that is formed from endoderm. Okay,
Okay.
then the muscle
Yes, ma'am.
fibers which forms an attachment to the organ to the outside in the middleman, that is derived from mesoderm. All the cartilage, muscles, and all that. Then the skin and the outermost lining, that is formed from ectoderm. Okay.
Yes, sir. Yes, sir.
It is stratified squamous epithelium and may or may not be keratinized. See, what happens is when it comes to this epithelium, there are few cells called keratinocytes. If the keratinocytes are present, they secrete keratin. Keratin is a proteinaceous layer over the epithelium, which is more resistant.
Yes,
So
sir.
such kind of epithelium is called keratinized epithelium. If there are no keratinocytes present in the epithelium, then the protein layer is not formed, and that is called non-keratinized epithelium.
Okay.
When coming to oral epithelium, it is always keratinized. Okay,
Yes,
mostly it is keratinized. In few cases, very rare, it is not keratinized. Okay.
yes,
Then beneath the epithelium lies the connective tissue. Clear?
yes, ma'am.
Now the oral keratinized oral epithelium, there are layers. Epithelium itself is divided into stratum basale, which is the basal layer or the lowermost layer, then stratum spinosum, then granulosum, which is the granular layer, and then the corneum, which is formed due to secretion of keratinocytes, which is keratin. Okay.
Yes, ma'am.
So we have stratum basale, spinosum, granulosum, corneum from down to up in the epithelium.
Yes, ma'am.
See. Stratum basale, what do they have? They have mitochondria, endoplasmic reticulum, the basement membrane, and desmosomes. Stratum spinosum have Golgi complex and tonofibrils. Granulosum has laminated granules present. And stratum corneum has liquid droplets derived from keratinocytes. Now the keratin. Okay.
Yes, ma'am.
So keratinized epithelium has corneum, granulosum, spinosum, and basale. Below that you have the basement membrane.
Yes, ma'am.
Okay. See the same thing. Corneum, granulosum, spinosum, and the basal layer below which is the basement membrane. Now coming to keratinized oral epithelium. Most of the oral mucosal surface is lined by non-keratinized stratified squamous epithelium except gingiva, hard palate, and dorsal surface of the tongue where the epithelium is keratinized. See, in the oral epithelium, there are few parts which are keratinized, which are not keratinized. Okay. Gingiva, hard palate, and the dorsum of the tongue, epithelium is keratinized. Rest all other places, it is not keratinized.
Okay.
Gingiva, hard palate, dorsum of the tongue, keratinized.
And
Rest,
everything else is non-keratinized.
Yes, soft palate and everything is not keratinized.
I was asking, this keratin is a protein, right, ma'am?
Yeah, keratin is a protein.
What
it
is
makes
the importance of keratin?
Rigid.
More rigid. Oh, okay,
Yeah.
okay.
Like hard, resistant.
Okay, okay.
Okay. See, why it is present in hard palate is hard palate has rugae.
Okay, yes, ma'am. I know.
More harder. Okay.
Okay.
That is why it's keratinized. The keratinized cells have no nuclei and the cytoplasm is displaced by large number of keratin filaments. Keratinized epithelium is associated with masticatory function and have 4 layers of cells. See, wherever masticatory is involved, keratinized epithelium is present. That is how it makes the epithelium more harder for mastication. Okay.
Okay. Okay.
Yeah. So then again, oral epithelium keratinized and not keratinized. 60% of the oral mucosa, which is buccal mucosa, labial mucosa, soft palate, alveolar mucosa, ventral surface of the tongue is not keratinized. Okay.
Yes, ma'am. Yes, ma'am.
Keratinized is the masticated mucosa, which is of the gingiva and the hard palate, and the dorsum of the tongue, which is a specialized mucosa. Clear?
This in non-keratinized, it's written surface of the tongue, right, ma'am?
Ventral surface, that is the lower. Ventral is the below portion.
Oh,
Dorsum
floor,
the top
floor.
portion.
Okay, got it, ma'am.
Okay.
Ventral. That's what.
Okay,
Yes,
fine. It's okay. It's okay. Okay, now clear with the type. What is keratinized? What is non-keratinized epithelium?
Yes, ma'am. Yes.
Okay. So the 4 layers, the same thing again. Okay.
Yes, ma'am.
Oral mucosa, epithelium, then the connective tissue.
Okay.
Then Coming to in depth, oral epithelium. The epithelium is made up of stratified squamous epithelium. Then below is the connective tissue.
Yes,
And this is the epithelial
ma'am.
ridges or the pegs, retipegs in the epithelium.
Ep-
Okay.
Epithelial what, ma'am? Ridge. Okay, epithelial ridge.
Retipegs,
Okay, got it. Yeah.
retipegs or ridges. Okay, then below that we have connective tissue, which is also called lamina propria. Then below that we have the base. This is the basement membrane, which separates the connective tissue with the epithelium. Connective tissue and epithelium. Then again we have minor salivary glands in the submucosal layer. Then we have periosteum and bone. Okay.
Okay, ma'am. Okay, ma'am.
Coming to individual layers. What is in stratum basale, spinosum, granulosum, and corneum? Those are the 4 layers of epithelium, correct?
Yes, ma'am.
Yes. So coming
Hey,
to
this is
stratum
one
basale.
layer. Yes, ma'am.
In the epithelium, it is 4, from lower to upper, correct?
And this is the topmost, right, ma'am?
No. See, basale is the lowermost, then spinosum, then granulosum, then corneum.
Oh, from down
Down.
to up. Yes, ma'am. Got it.
Yes. Okay. So coming to stratum
Okay,
basale, the cells of the stratum basale are cuboidal or low columnar and form a single layer resting on the basal lamina.
okay, ma'am.
The basal lamina is at an interference of epithelium and the lamina propria, correct?
Okay, ma'am. Yes, ma'am.
Epithelial cells of the oral mucosa are in constant state of renewal. So they keep the topmost layer cells keep dying. From down again they keep producing, then they mature, then they reach the topmost layer, again they shed off, again from down they keep on going up. Okay, so it is a
Yeah,
constant
yeah.
process.
Okay, ma'am.
The basal cells show maximum mitotic activity because how much basal cells produce, so much is the topmost layer epithelium going to reach. Correct?
Yes, ma'am. Yes, ma'am.
Okay. So this is all about stratum basal.
Okay, ma'am.
Okay. Then stratum. Oh, I missed stratum. Okay. There is one slide missing, which is stratum spinosum. Okay, I'll just get back to that.
Yeah.
Okay. So then coming to stratum granulosum, cells of stratum granulosum are flat and are found in layer of 3 to 5 cells thick. This layer is
Okay.
prominent in keratinized epithelium and absent in non-keratinized epithelium. Because these are the ones which will have keratin granules or keratinocytes which produce keratin to form stratum corneum. Okay. So this layer is present in keratinized epithelium and absent in, like it is not prominent in non-keratinized epithelium.
Okay, and this is the third layer. Okay, got it.
Yeah, thirdly,
Okay.
these cells have keratohyalin granules in their cytoplasm, which are responsible for secretion of keratin. Okay.
Yes, ma'am.
Keratohyalin granules help to form the matrix of keratin fibers found in the superficial layer, that is stratum corneum.
Okay.
Okay.
Yes, ma'am.
Coming to stratum corneum, cells of stratum corneum are flat, devoid of nuclei and full of keratin filaments surrounded by a matrix. These cells are continuously being slogged and are replaced by epithelial cells that migrate from the underlying layers. Okay.
Okay.
Coming to non-keratin, this is all about keratinized epithelium. Okay.
Okay, ma'am.
Coming to non-keratinized epithelium, in the superficial layers do not have keratin filaments in cytoplasm. The surface cells also have nuclei. The stratum corneum and stratum granulosum layers are absent. The epithelium is associated with lining of oral cavity.
Okay, and these type of epitheliums have that salivary glands, no, ma'am?
No, you're getting confused. Salivary glands is present in the submucosal layer. Now we are
That is
talking
under
only about
the
epithelium layer. Below epithelium, we have lamina propria, which is connective tissue. Below that connective tissue, we have submucosa, which has salivary glands. And below that, we have periosteum and bone.
Okay, ma'am. Okay.
This is non-keratinized epithelium is found in the linings, where ventral surface of the tongue, floor of the mouth, cheek lining, all that.
Okay, got it, ma'am. Yes, ma'am.
Okay.
Ma'am, but cheek linings have minor salivary glands, no, ma'am?
Okay. See, you're getting confused. I'll just see, Baba. What is it is we are talking only till here. Only this epithelium portion we are talking. We are not talking about salivary glands which are present in the submucosal layer. We are talking only about epithelium layer. Only this layer we are talking. Don't confuse. Salivary glands is present in both keratinized and non-keratinized. Connective tissue is also present in both. Only epithelium there is difference. Non-keratinized epithelium. So what are the non-keratinocytes? There's something called as non-keratinocytes or clear cells. Okay. So they are melanocytes, Langerhans cells, Merkel cells, and inflammatory cells. Okay. Why are they called clear cells? Because what happens, the cytoplasm around the nucleus will shrink and the cell will appear more transparent. That is why they are called clear cells. Shrink. Okay. When you start to stain it, no, the cytoplasm gets shrunk after when you're starting to stain it with H&E. Hematoxylin and eosin staining, no, the cytoplasm shrinks. Then it makes the cell more transparent. That is why it's called clear cells. And they do not secrete keratin. So they're called non-keratinocytes. You should remember this. Langerhans cells, melanocytes, Merkel cells, inflammatory cells. They will ask you in the exam, and they have asked also. What are non-keratinocytes? Okay. See why they don't have also they've given. See, we are very few in number, so they do not take. We do not undergo maturation. We don't have cytokeratins. Okay. Then coming to lamina propria. Lamina propria is the one layer below the epithelium. Correct? So what do they have?
Yes, ma'am.
They have fibroblast, macrophages, blood capillaries. Okay. Connective tissue can be differentiated as lamina propria and submucosa. Okay. Lamina propria is the connective tissue layer immediately below the epithelium. It is divided into papillary and reticular layers. Papillary layer forms finger-like projections of connective tissue that extend deep in the epithelial layers. So here we saw that, see, epithelium is like this with retipegs, no? So the connective tissue which is present in these projections, this is called papillary connective tissue. And below that, what is present? The connective tissue present below that is called reticular layer of lamina propria. Okay. Papillary layer forms finger-like projections of connective tissue that extend deep in epithelial layers. Papillary layer is prominent in masticated mucosa and reticular layer is prominent in lining mucosa. Lamina propria consists of blood vessels and cells like fibroblast, cells of blood vessels, lymphatics, and nerves. Connective tissue. Epithelium is avascular, hence its metabolic needs come via the vessels of lamina propria. Any doubt?
Yes, ma'am. Okay, ma'am.
Clear? Epithelium, the superficial layer is avascular. There is no blood supply, nerve supply to that.
Yes,
so the lamina propria, which is below it, only provides all the nourishment. Okay.
Yes, ma'am.
Coming to submucosa. Submucosa lies below lamina propria and serve as attachment between lamina propria and bone or skeletal muscle.
Like a connective tissue.
Yes, in the connective tissue we had two portions. One is lamina propria, one is submucosa.
Yes, ma'am.
See, epithelium, connective tissue. This is lamina propria. This is submucosa.
Yes, ma'am.
Okay, so submucosa acts as an attachment between the lamina propria and the underlying bone or periosteum. Clear?
Yes, ma'am.
It is found in cheeks, lips, and parts of the palate.
Okay, ma'am.
It consists of large blood vessels, nerves, and lymphatics, and its functions are nutrition and defense mechanism.
Okay, ma'am.
So, functional type of oral mucosa. So, we saw there were two types. One was lining mucosa, one was masticating mucosa. Specialized mucosa is only limited to tongue. Okay.
Okay, ma'am.
So, coming to lining mucosa covers all soft tissues of the oral cavity except the gingiva, hard palate, and dorsum of the tongue. Clear?
Yes, ma'am.
Lips, it is covered by lining mucosa.
Yes, ma'am.
Vermilion border, the junction between the skin and the mucous membrane is known as the vermilion border, corner of the lip. Here the epithelium is thin, therefore the red blood cells in the capillary show through, contributing to vermilion color.
Skin and mucus. Ma'am,
Yes.
can you repeat this? I didn't understand.
See, vermilion border, the corner of the lip, where from
No, but
external
between skin and mucous membrane, there are many layers, no, ma'am.
No, see, out on the face you have skin. Inside the
Yes.
mouth you have oral mucosa.
Yes,
So
ma'am.
from inside to outside, that connection, the joint, that is a corner of the lip.
Okay. Got it, ma'am.
That junction is called vermilion border.
Got it.
And that because it has more of red blood cells, that is how it contributes to vermilion color. That is the lips color,
Yes,
red color.
Yes, ma'am.
Clear?
Yes, ma'am.
Okay. So coming to vermilion border, see, this is the tooth. Okay, and this is the vestibule. And this is the lip. Okay, the tooth, vestibule, and the lip, and this is the gingiva covering the tooth.
Okay, ma'am.
Okay.
Okay.
And this is the lower part of the lip, lower part where you have minute hair.
Yes, ma'am.
Okay.
Yes,
and
ma'am.
the lip is made up of skeletal muscle, and the border, which is responsible for the color of your lip. Because the epithelium is very thin and the RBCs reflect. Whatever RBC color is there, that is the color of your lip. Okay.
Yes, ma'am.
So now coming to ventral surface of the tongue, it's lined by, ventral surface is lined by
the lamina propria.
Epithelium. What type of mucosa?
Submucosa, no?
Mucosa is only 3 types. One is masticated mucosa, one is lining mucosa, one is specialized mucosa.
Oh, like that, specialized, no?
In ventral surface of the tongue, not dorsum of the tongue. Only dorsum is lined by specialized. Ventral is lined by
this lining.
Lining mucosa. Yes.
All together, I'm getting confused.
Okay. Now I'll make it. Now write it down somewhere.
Because I know tongue, ma'am. Tongue
up is made up of specialized mucosa because it has taste buds. The ventral or the below part of the tongue is made up of lining mucosa, and the floor of the mouth is also made up of lining mucosa. Then vestibule, labial vestibule, buccal vestibule, cheek. All this is made up of lining. Hard palate, gingiva is masticated mucosa.
Yeah, yes.
Okay. So the ventral surface of the tongue, the lining mucosa here contains both lamina propria and submucosa. The submucosa merges with the muscle bundles of the ventral surface of the tongue because ventral surface is made of muscle and not of bone. So submucosa acts as an attachment between the muscles on the ventral surface of the tongue and the lamina propria. Okay. Yeah. Coming to cheek, in the cheek, the underlying mucosa contains fat cells and small mixed salivary glands. See, we're asking about cheek and salivary glands. See, here they are.
Yes, ma'am.
Okay.
Yes, ma'am.
Fat cells, adipose tissue is present in the cheek. That is why chubby people have more of fat.
Yes, ma'am.
Okay.
Yes, ma'am.
Then coming to floor of the mouth, the mucous membrane of the floor of the mouth is thin and loosely attached to the underlying structures.
Okay.
That is all about lining mucosa. When floor of the mouth, cheek, ventral surface of the tongue, vermilion border, and the lip. Okay.
Okay.
Coming to masticated mucosa. Masticated mucosa covers gingiva and hard palate. Clear?
Yes, ma'am.
In edentulous mouth, masticatory covers over the chewing surface of the dental arches. That is when people don't have teeth, the gum pads, the mucosa covering the gum pads is also masticated mucosa. Because that is nothing but gingiva. Correct?
Yes, ma'am. Yes.
Okay. So coming to gingiva, gingiva has keratinized or parakeratinized epithelium with no submucosal layers.
Okay.
So what is the difference between orthokeratinized and parakeratinized epithelium? See, in orthokeratinized epithelium, what happens is the topmost layer, the cells do not have nuclei. If there is absence of nuclei, that is orthokeratinized. If there is pyknotic or very small nuclei, that is called parakeratinized.
Yes, ma'am.
Okay, this is the only one difference between
One has
orthokerat.
nucleus and one doesn't have nucleus.
Yes, correct.
Okay,
Correct.
got it.
Okay, ortho means it's completely keratinized. The keratin filaments are filled in the cells that there is no space for nucleus, and the nucleus disintegrates or degenerates. But in parakeratinized, it's partially keratinized and there is some pygnotic or very minute nuclei present in the cell. That is parakeratinized epithelium. Clear?
Yes, ma'am.
They do not have submucosal layers.
Okay.
It develops from the union of oral epithelium and reduced enamel epithelium of the developing tooth.
Okay.
Gingiva can be classified as free gingiva, attached gingiva, interdental papilla.
Okay, ma'am.
This is the normal gingiva. Okay,
The pink one, no?
this pink one, the whole
Okay.
thing. They've
Yes, ma'am.
stained it. That is why it's looking yellowish. But the whole thing is gingiva.
Okay, ma'am.
Okay, and there is one frenum present, which is called labial frenum.
Okay, ma'am. The center one, no?
Yeah, the center one. Okay.
Okay.
Then this is called buccal labial. This is again buccal frenum. And here also we have buccal frenum.
The one that's connecting the teeth to the cheek.
This one. Yes. This. Yeah. These four.
Yes, ma'am.
Okay.
Okay.
Coming to the picture. See, the gingiva which is around the tooth is called marginal gingiva.
Okay.
Okay. Then the gingiva present in between one tooth to another in interdental space is called interdental papilla.
Okay, ma'am.
Okay. So the thing which helps in attachment of the tooth, that the gingiva attached to the tooth is called attached gingiva. Wait, in this picture I'll tell you. See, the gingiva which is near this border is called free gingiva or marginal gingiva.
Okay, ma'am.
Okay. Then the gingiva attaching to the tooth is called attached gingiva. Here, below this free gingiva is attached gingiva.
Okay,
And
ma'am.
in between the tooth, this is called interdental papilla or interdental gingiva.
Okay.
Okay.
But in
Then,
between tooth gingiva is that?
yeah, this papilla, interdental papilla, you have this in between one tooth to another.
Okay, ma'am.
A picture of the tooth, I think I would know. Okay. So in between the tooth, there is thing papilla that's called interdental papilla.
Okay, ma'am.
Okay. And then alveomucosal line.
Okay, ma'am.
Mucogingival junction or alveomucosal line.
Okay, ma'am.
This is the alveolar mucosa, which is to the bone.
Okay, ma'am.
Now you know what is free marginal gingiva or the free gingiva, which is the same. Then you know what is attached gingiva. Then you know what is interdental papilla. Then mucogingival junction and alveolar mucosa. These five are important about gingiva. Okay.
Yes, ma'am.
So next, coming into individual, what is free gingiva or marginal gingiva?
Okay, ma'am.
It is that part of the oral mucosa that surrounds the neck of the tooth and forms the free margins of gingival tissue.
Okay, ma'am.
Okay.